In this tutorial, I'm going to show you a way to design your flaps so you can get accurate measurements for them. This is especially complicated when you're doing 3D structures, complex structure. Like in this case, we're going to do the nose and the upper lip because you're usually taking a flap from an area that's going to be 2D or flat. Like in this case, we're going to use a forehead and then converting that flat structure into a 3D structure. So it's very hard to get accurate measurements, and you don't want to be in that position where you don't have enough soft tissue coverage to cover your structures, and they're too tight, or a chance of adhesions, or you can't even close them, or you have too much soft tissue and you have a larger donor area than you would have needed to have in the first place. So in this case, we're going to use 3D photography. This was first presented by me in February 2016 at the Johnny Boswick Burn meeting in Maui, which is a great meeting, by the way. I encourage everyone to be there. So let's get right to it. So in this case, I'm just going to paint the area. I'm going to show you sort of what we're trying to cover. Let's think about this. Requiring, resection of the nose and the upper lip for whatever reason. So, yes, in this case, we're doing reconstruction like we do have a pre-op picture. Not the same if you get a traumatic amputation, but I'll give you some tips about how you can do that if you have a patient where you don't have a pre-op picture. So let's just kind of figure out the area of interest here. And so sort of like this. All right, and I'm just not gonna be too precise right now, just because I don't want to take too much time to show you guys, just so you can get a sense of what we want to do and how you can do it. If we turn around, you're gonna see that I'm not even all the way where I would want to be. So this area needs to be part of my soft tissue coverage. So I need to say that, and this area is about the same. So we need to go all the way back here so that you can actually suture it against skin and get the projection that you need for the nose. All right, so we have that, and now we figure out the area that we want to that we need to reconstruct. All right, so right now I'm just gonna deselect or clear the area. And what I'm gonna do is I'm gonna start placing landmarks, and you can even do this on paper. I'm gonna do it on Autodesk Inventor, which is, well, Autodesk is probably one of the best series of software around. Basically, what I'm gonna do is I'm gonna put landmarks all over the midline. I'm gonna put landmarks that I'm gonna use to measure distance across surface. So that way I actually get not only the XY but also get the Z. So you get the interior surface, but you also get the projection on the back on your distance. And then we're going to transpose that, which, as I said, you can transpose on a piece of paper or you can do it on Autodesk Inventor. So I'm just going to be quick here. I'm going to put a landmark. I'll start right here and at the nose, and I'm going to put a landmark right here. So I'm going to measure distance, and you can see I have in this case straight across, straight line between landmarks or across surface. So I want to do across surface. I want to show you the difference. 1 second. So this is straight. You see it says 11 millimeters, and now if I measure, I have to select them again, I guess. Now if I measure the distance across surface, so you see there's not a lot of projection in this area, but you do see there's a difference. So it was 11 millimeters, it's 11.36 millimeters. So let me show you. All right, there's not going to be a lot of projection in that one. All right, let's keep going. I'm going to put another landmark so you can see. I like to put at least 10 landmarks on the midline. Just one area where you're going to have a lot of projection, the tip of your nose, and right here. Actually, this one should be a little lower. You want to try to make them as accurate as possible here. And we're going to measure, let's do again straight and then across. So 26.7 millimeters straight distance, and if I do across surface, sorry about that, let's do it deselected. So let's do distance across surface. You see 28.7 millimeters, 2 millimeter difference. Significant difference, and you can fall short if you don't do that. So what we're going to do is we're going to continue doing that. I'm just going to do a couple more so you can get a sense of what we're trying to do. One that I always find very important is going to be right here, this measurement. And then when you get those measurements, or you can do it one at a time when we're doing the midline, or you can do the whole nose, you go to your piece of paper. So I'm going to go to Autodesk Inventor. This is already done because I already made it. But basically what you want to do is you want to go on the midline and you want to put your landmark. So you start, let's go a little bit down here, we'll make a new one. I'm going to start right here. Okay, this is your starting point, which can be 0 right here, but we're not using 0. And then you're going to go down to whatever distance you have on your landmarks in the midline. So as I said, you want to do as much as possible. So they're going to be close. But in this one, let's just say we're doing a centimeter in between, which it should be a little bit more. Let's just do a centimeter. All right, so 10 millimeters. And then you do photo and you select, say you start right here, you're going to select the distance that you have right here. So in this case, we said it was 11.36 millimeters. So we make a line, it's going to be 11.3 millimeters. All right. And okay. Then you go back here, let's say you have a landmark. You're going to put another landmark right here. Selected those two. It looks like maybe the interior one's higher. Yeah, so you want to avoid that. You want to have them at the same height. So we're just going to move this one. And going to move it back here. Front. And it's not in the midline, so put it in the midline. Alright, so I'm going to measure again distance across surface, 13.85, but also at the same time what you want to do is you want to measure the distance between these two. Measure distance. You want to measure the distance. And we're pretty close to a centimeter. We're 10.578, and for this the purposes of the video, I'm just going to let it be. But you can bring it higher up, or you can put an Autodesk Inventor at 10.5. And 13.85 is our length, so we're going to do 13.85. Alright, so that's we have that. You keep doing this, and you're going to have something that looks like a little Christmas tree sort of thing, and then you just can basically connect the dots. So let me just put one more so you can get an idea how it's going to look. So it's going to look something like this, and you basically just connect the dots. All right. And I'm going to go on here and connect the dots. All right. So. And then when you have your structure completed, you can, if you want, you can definitely delete what you use for your measurements. Let's go back up here for a second. So here's how it looks like at the end. All right, and I give you a little curve form here. Well, you can see where actually the measurements are. The system will soften them, and making more of a low curve, because that's why I selected instead of being right acute angles. And it's okay. It will be easier once you use it for your surgery. And this is the upper lip area, so we're using the same principle. So basically, you're going to have half of it, and then you put a symmetry line, and you get the other side, or you can even print it just with half of it. And once you cut it, and I'll show you what I'm talking about in a second, you could just fold it and get both at the same time. So I'm just going to delete this. I'm going to go front, and I'm going to see our structure here. I'm just going to finish this sketch, and after that, I exported it into a sheet of paper, and I have a PDF format here. So I have two. This is going to be the original size, 100%, and this way I increased about, I think, 20%. Young people, they have more skin elasticity, a little bit more retraction. So you do want to go around 20% increase in size. If it's an older person, you might get away with 10-15% because their skin will not retract as much. So basically you have that, and now we're going to print it. So this is what you're going to use as template to draw with the forehead to transpose and create a flap. So here, as you can see, we're going to have the printed PDF, and this is what we're going to cut right now. So now we're folding it in half, and we'll proceed to cut it. So I'm just detach it and finishing it up. Okay, so now we have this, and we're gonna build it sort of a little origami type of thing. You obviously don't need to do this, trying to build it like a little origami, because well, it's gonna be when you do the surgery with the soft tissue. But I just wanted to show you folding right here and folding on the sides, just to give you more of a nose shape. And here you can see, you know, we're getting the projection on the nose. So this is why this is a good method, because you convert the 2D into a 3D model. And I'll show you the finished product now. So this is the final model, and you can see how it looks, and it gives you a projection. So I hope you enjoyed the video, and if you guys want more information on how to do this, let us know, and make sure to go to the Johnny Bosco meeting next year. Thank you very much.